My name is Christine Clements, and I'm a certified hand therapist.
And I'm Paige Ryback, and I'm an occupational therapist pursuing my hand certification.
This is Jacob. He was a pretty unique individual. His job was to work in manufacturing. One day, the machine he was using malfunctioned, and it caught his finger in a press-like piece of equipment. He was actually stuck for a period of time and had to be rescued. Caused some pretty significant injury to his index finger. So when he first came to us, he was unable to use the left index finger at all. We had a lot of difficulty with his poor range of motion, his strength. Of course, we had to address scarring, wound healing. He had a lot of edema throughout the finger. But by the time he left, he was able to use the finger pretty normally. He was able to actually even return to something that seemed simple that really wasn't, and that's playing his guitar. He did have some residual deficits at the end joint of the finger, but he was pretty happy with where he ended up.
So the wonderful thing about the BTE is that it simulates all work occupations. So anything that he's going to return to at work or has to do, we can pretty much simulate it with this device. So some of the activities that Jacob completed was pushing, pulling, turning, just anything where we had to kind of simulate the job and improve his range of motion, his strength, and the endurance component. So as you can see in the video, he's doing a lot of gripping and turning and twisting, simulating his day-to-day functions.
So close your toe. Correct. Straight down. One of the components of the BTE work simulator that makes it so valuable is that we can do assessment with it to grade their progress. We can do both isometric and isotonic work. Like Paige said, there's a variety of tool attachments that come in handy. We can simulate things like screwdrivers, opening a jar, reaching for something off a top shelf. The sky's the limit as long as the therapist uses their creativity and tries to simulate the known activities that the patient is returned to.
The BTE work simulator also allows us to isolate the desired muscle groups. So for example, if the patient was really trying to achieve greater end range wrist flexion and extension, they have this wonderful attachment that we can use. You can put the forearm in, and it allows you to really isolate that targeted muscle group so we can improve that end range motion.
Another great thing about the BTE is that we can use unilateral or bilateral integration of the upper extremities to more successfully simulate the return to daily activities and work tasks. We actually have a monitor the patient can look at while they're performing the exercise, and that monitor shows them their effort as related to torque resistance and endurance. It's a combined measurement. And so they can have that visual feedback throughout the exercise to see how they're progressing. So here's a really interesting story. I had a young man who was a mechanic, and one of the things he had to return to that was almost impossible to simulate in the clinic was working underneath a car. So I actually had him lay down on the ground and lowered the BTE head to a point where he was working on his back, vision occluded, like a mechanic would do in his day-to-day activities. One of the unique features of the BTE as well is that it has a magnetic head, and we're able to increase that resistance just with the touch of a button on the screen. We work with the patient one-on-one. We see how they're responding to these increases, and then we modify it accordingly. So one day we may be increasing the torque resistance and the amount of force they work against. The next day we might be trying to increase their endurance, and so we'll increase the time component of the exercise.
So for this specific activity or exercise, it compares where the patient was at their last session and where they're at today. So we should see a change in power or in the work output or even just the distance. So this just gives us data on if they're progressing how they should be or if there needs to be some changes to the treatment plan.
The BTE can be housed in a very small space. So it works really well for us. We don't have to have a giant clinic, yet we're able to simulate pushing, pulling, reaching, lifting, gross grasp, deviation of the wrist, supination and pronation. We can do all these attachments in a very limited space.
If you know anyone that could benefit from the BTE Work Simulator, it is available at Renue Physical Therapy on Bay Road in Saginaw.